Hello, everyone. My name is Claretta Bellamy, and today's topic will be about the coronavirus. Also called COVID-19, the first reported case of the virus was confirmed in China on January 11th of this year. Now, the virus has spread worldwide. There are over 3 million confirmed cases around the world, with 1 million cases being in the United States. In New Jersey alone, there are over 114,000 cases. Tragically, over 200,000 people have died around the world, and over 60,000 people have died in the United States. Today, I'm going to talk to Jaquelin Rivas, an emergency room nurse at St. Joseph's Regional Medical Center in Paterson, to hear about the experiences from one of the many essential workers that put themselves on the front line every day to care for patients during this pandemic. Thank you, Jaquelin, for joining me today.
Hi, Claretta. Thank you for having me.
My first question for you is, how was it
Mhm.
to start working at a hospital in the midst of a pandemic?
It's been kind of scary because my job in general entails very high paced scenarios because I work in the emergency room. So that alone was kind of like a lot to deal with just being a new grad. And now we're being pushed to know more quicker um, because of the pandemic that's going on right now. And so I feel like I've learned so much so quickly in a very, very short time span.
What have you been seeing more specifically in the emergency room during the pandemic with all these COVID-19 cases?
We had a lot of respiratory cases, but that quickly turned into basically everybody. Everybody that we saw was a respiratory case, and everyone that we're seeing even now, like months later, weeks later, we are still seeing corona patients, and it's been a complete shock to everybody. People who have been nurses for 20, 30 years, and they've explained to me that they have never witnessed something like this in all the years that they've been a nurse. They've never seen such a huge pandemic that's grown so quickly and affected so many people at once. And it's kind of scary to think that because we do live in a pretty well developed country, and for us to not have the resources, not have the proper staff, running out of ventilators, running out of so many things that we need is pretty scary.
And how was it like going to work every day? I see a lot of, across different social media platforms, a lot of nurses are crying, putting posts about how they're so overwhelmed. I think a few
Hmm.
nurses actually quit because it was just too much for them.
Yeah.
So, how have you been through all of this?
In the beginning for me, it was very, very difficult to cope mentally, um, because I've never witnessed so much death in my life. Coping wise, I've made sure to talk about, the situations that I've been in at work, the cases that I've had with my coworkers, um, especially those coworkers that are new grads. We have like a little group where we just kind of spill out all the emotion, spill out all the problems that we've faced that day or that week. We make sure to come together, have lunch, and just talk about these things.
I know that based on what we have now, information that the people that are more at risk are the elderly population and those with underlying health conditions. So, what
Mhm.
type of people are you seeing in a hospital? Because I've also seen or heard that younger people are at risk as well.
So most of our cases that are pretty severe end up being people who have different comorbidities. So people with different underlying diseases, illnesses, respiratory um, problems that they've had for a long time. Definitely, the older population is a lot more at risk. Those who are overweight as well have been affected a lot.
What are the common symptoms that patients have when they come into the ER who have COVID-19?
That's a good question. So COVID-19 affects everyone a completely different way. You could be walking around and feel perfectly fine, not even feel sick. And you can have COVID-19 and be able to transmit that to other people. Then there's another, I guess, level you can say where you do feel sick, right? You feel like you have the flu or a cold, you have shortness of breath, or you're coughing and sneezing. That's when you feel a lot more sick, but yet you don't really need to go to the hospital. Usually, the people that I see in the emergency room are people who are having a lot of trouble breathing. So, our emergency room has actually been converted into a huge ICU floor, and a lot of my patients are on ventilators.
How is your family doing during all of this?
Right now, it's kind of I think, a hard time for my parents because my brother is away. I have a brother who's in the Marine Corps, and we haven't really talked to him or seen him or spoken to him in a couple months. And now, actually, I've been living at a hotel at the Hilton Inn for the past 4 weeks now. My parents are older. I want to make sure they're safe.
I know your birthday was April 28th. So what did you
Mm-hmm.
do to celebrate?
I really wanted to spend time with my family because I hadn't seen them in a long time. So I did go home and spend some time with my family. And then my parents, oddly enough, surprised me with this like birthday parade. So they contacted all my friends. They made sure that they were all wearing masks and gloves, and they walked. My dad was calling me. He's like, "Hey, come outside." And I was like, "Okay, why do I need to go outside?" And it's like I walk outside, and it's literally like a line of people just like walking by. And I was like, "What is going on?" And I didn't recognize everyone because they were wearing masks, and it was very heartwarming to see that even though we are going through this pandemic, people are still able to show their love and support in very creative ways.
How is St. Joseph's looking now? Is the amount of patients gone down?
The waiting room number has gone down a lot, and we've also had travel nurses come from different states, especially Colorado. So shout out to Colorado, thank you for sending travel nurses, and that has lessened the workload on our nurses in the ER. Which we still have some very, very severe cases. We still have people on ventilators. That hasn't changed at all. We're still holding people in the ER, but I think um, it's more controlled now because we have the proper staff to take care of them. It's very scary because if our first peak was this intense, imagine what the second peak will end up looking like. So I know for sure this pandemic isn't over, but I do have high hopes.
Thank you, Jaquelin, for taking the time to speak with me today. And I also want to thank all the other essential workers that are putting themselves on the front line every day to help care for patients around the world. So thank you.
Thank you so much, Claretta. I appreciate it.